Hello, my name is Jalen. I'll be going over the treatment plan for our patient. So the first thing we're going to do is first provide oxygen and ventilation. And we do this by providing high flow oxygen devices, which are devices that could be a BiPAP, CPAP, a Venimask, or non-rebreather. These devices work better than just your regular nasal cannula, which our patient is on 6 liters nasal cannula oxygen wise. So some complications that we would monitor for these devices, high flow oxygen devices, are any complications that they are not getting enough oxygen. So we would look into either pulmonary edema or pulmonary embolism. Next, we will also look at the short-acting bronchodilators. These are your breathing treatments. These are your albuterol, your Duonev. These are going to open up the lungs and help oxygen flow in and out better. So these breathing treatments, they are administered through a nebulizer or through an inhaler. Also, we monitor for the side effects and the adverse effects and the possible outcomes of these medications. Moving on, we also administer steroids. So these steroids can be given oral or through the IV. It just depends on if it's a high dose or a low dose steroid regimen. We have to take in consideration that our patient, what is his appetite and what is his nutrition? Is he able to absorb the medication if it's given oral, or do we just need to just give it through the IV for the quickest route? Through joint commission is either or. It just depends on your patient and just depends on the patient at the moment. Then we move on to antibiotics. So the antibiotics are broad spectrum or narrow. These can be your vancomycins, your zosins, and your amoxicillins. These antibiotics are given to treat the patient pneumonia, and most of the times when patients with COPD, they also have some bacteria in their lungs, so we give them antibiotics. Moving on to the treatment plan, it's important to look at the pneumonia vaccine. If the patient has received the pneumonia vaccine, and just go ahead and give it. And if it's the flu season, just go ahead and just give them the flu injection if they agree to it. And also with the antibiotics, we're going to do the blood cultures. So when a patient comes in, we do blood cultures within the first 24 hours, and then that patient will be getting antibiotics based on the blood cultures that comes back. These treatment plans are found through the Joint Commission, core measures, and this is for our patient treatment plans. Moving on, we have critical thinking questions. So my question I will ask to you is, how would you evaluate the effectiveness of the patient oxygenation and ventilation? Answers. The answers you would give or you would monitor for is the ABGs, the oxygen saturation, assessment of the patient mentation status, and vital signs. The ABGs monitor the patient's CO2 or the carbon dioxide. The oxygen saturation is the O2 sats of the patient. Assessment of the patient mentation status. This can give you an assessment of how the patient is oxygen-wise, because most of the time when you have somebody who's hypoxic, their mentation is altered, and just monitoring their vital signs. This concludes my presentation, and thank you for watching.